Welcome. My name is Shelby Lucas. I have a Bachelor of Arts in English, History, Secondary Education, and Lutheran Education. One of my passions is research. When I became pregnant in 2015, I started researching vaccines. I began my journey by talking with doctors, who all told me the same thing, to do my own research and make my own decision. I followed the advice of those doctors. I am here today to share what I have learned over the past 2.5 years. This presentation is meant for educational and informational purposes only. This presentation does not replace medical care from a medical professional. What is the flu? What is it not? Influenza is a virus that infects the respiratory system, causing aches, cough, fatigue, fever, headache, and sore throat, according to the CDC. Influenza is the flu. There are 3 types of influenza viruses, A, B, and C. Type A is most severe of the types. It is also more likely to mutate. Type B is less severe and affects mostly children. Type C is very mild and similar to the common cold. These 3 types have hundreds of subtypes. H1N1 is an example of a subtype of type A. Flu vaccines were developed to prevent 3 or 4 subtypes of influenza A and B, according to the United Kingdom National Health Service. Trivalent vaccines have 2 A types and 1 B type. Quadrivalent vaccines have 2 A types and 2 B types. Many other illnesses present with the same symptoms as the flu. These illnesses are called influenza-like illness. A few examples are rhinovirus, RSV, and adenovirus. These illnesses are caused by viruses that are not the same as the influenza virus. The flu shot does not prevent any of these flu-like illnesses. The stomach flu, actually called gastroenteritis, involves abdominal cramps, diarrhea, fever, nausea, and vomiting. It is a common misconception that the flu shot will prevent that nasty stomach bug that seems to go around every year. According to the Mayo Clinic, the flu shot does not prevent gastroenteritis, because gastroenteritis is not the flu. Again, the flu shot is meant to prevent 3 or 4 strains of influenza virus. For this presentation, the word flu will refer to the influenza virus. How deadly is the influenza virus? Is it dangerous? The CDC gives an average of 36,000 flu deaths per year. The CDC reports over 50,000 flu deaths for some flu seasons. Such a large number is certainly serious. The CDC's source for flu data comes from the Morbidity and Mortality Weekly Report. However, the MMWR combines flu and pneumonia deaths, even though most cases of pneumonia are unrelated to flu, according to an article published in the British Medical Journal. The article gives an example of other causes of pneumonia. It states, stomach acid suppressing drugs are associated with a high risk of community-acquired pneumonia, but such drugs and pneumonia are not compiled as a single statistic. There are many causes of pneumonia, and to lump all pneumonia deaths with flu deaths is inaccurate. Rather than combining pneumonia and flu deaths, the National Center for Health Statistics reports flu deaths separately. How many annual deaths does the NCHS report? 1,348. This number is very different from the CDC's 36,000. Let's take a closer look at 1 year's flu death statistics. In 2001, the CDC reported over 62,034 flu deaths, but this is flu and pneumonia combined. If you look at the National Center for Health Statistics, they report 61,777 pneumonia deaths and only 257 flu deaths. Now, recall the previous information on influenza and flu-like illness. How many of these 257 deaths were confirmed by lab work to be influenza virus rather than a flu-like illness? 18. not 62,000. Concerning the swine flu of 2009, Dr. Robert Sears says H1N1 was no more serious than other years, despite media portrayal of an epidemic. How effective is the influenza vaccine? Does it work? This chart from the Journal of American Physicians and Surgeons shows the efficacy rating of flu vaccines during flu seasons from 2000 to 2005. The left column of percentages shows how often influenza virus was present compared to flu-like illness. During these flu seasons, only 12.5% of samples sent to laboratories from people experiencing flu symptoms tested positive for influenza virus. The rest had a flu-like illness. Hundreds of flu subtypes exist. When a flu shot is being developed in the spring, it must be estimated which 3 or 4 strains will be the dominant cause of influenza in the fall. In addition, strains can mutate during the time it takes to develop the vaccine. The middle column shows the antigenic match for that year. During these 5 flu seasons, the average antigenic match was 54.2%. That means the flu vaccine matched the dominant strains 54.2% of the time. The right column combines the information from the previous 2 columns to show the vaccine's total efficacy. For these 5 seasons, according to how many cases of flu were confirmed by lab results and how well that season's flu vaccine matched flu strains, the average total efficacy was 7.2%. In more recent years, the efficacy rate has not improved much. The 2014-2015 flu season only had an efficacy rate of 18% for adults and 15% for children ages 2 to 8, according to the CDC. Even seniors who received a high-dose flu shot, which contains 4 times the antigen amount, only had an efficacy rate of 24%. The statistics are even worse for children younger than 2, according to a study published in the Cochrane database. Despite this, the CDC recommends infants as young as 6 months are given the flu shot. The CDC recommends that the flu shot is received each year. However, studies, including one from the University of Minnesota, are showing that those who receive flu shots 2 years in a row have less protection than those who had not received a flu shot the previous 2 years. For those who have received flu shots 3 years in a row, they have an increased risk of being infected with influenza. Scientists are not sure why this is, and more research needs to be done. In the meantime, the CDC continues to recommend everyone receive flu shots each year. For children, the increase in risk is even more serious. A study by the American Thoracic Society found that children vaccinated against the flu are 3 times more likely to require hospitalization for influenza. The risk increases further for children who have asthma. Another study by the Infectious Diseases Society of America found that the influenza vaccine decreased children's ability to fight non-influenza viruses. Children who received the influenza vaccine were 4 times more likely than those who received a placebo to develop a flu-like respiratory infection. It is possible that children who contract influenza gain nonspecific immunity, which protects them from other flu-like infections. If this is true, it would explain why children who receive the flu vaccine are 4 times more likely to develop a flu-like illness. The CDC continues to advise parents to vaccinate children against the flu, even those with asthma, despite these findings. What is in a flu shot? The flu shot contains a killed or inactivated virus. Killed virus vaccines do not shed. This means the recipient is not contagious and cannot get the virus from the vaccine. Some people say they get the flu from a killed virus flu shot. This is not true. However, vaccines naturally weaken the immune system for about 2 weeks. During this time, vaccine recipients may come down with an illness, but that illness does not come from the killed virus vaccine. With a live virus flu vaccine, the virus is not inactivated. In live virus vaccines, the recipient can get sick with the virus from the vaccine. Whether or not the recipient gets sick, he or she is contagious for about 3 weeks, It is advised that people vaccinated with live viruses stay away from the elderly, pregnant women, infants, or immunosuppressed during the contagious period, according to the Johns Hopkins Hospital and the American Academy of Allergy, Asthma, and Immunology. Live virus vaccines include vaccines for rotavirus, chickenpox, smallpox, shingles, and yellow fever. The vaccine for measles, mumps, and rubella contains 3 live viruses. FluMist is an influenza vaccine in the form of a nasal spray. It is a live virus vaccine, but it was discontinued in America after the 2015-2016 flu season because it was discovered to be less effective than inactivated virus vaccines. According to package inserts available on the FDA website, there are no live virus flu vaccines for the 2017-2018 flu season. This may change in future years, as FluMist is currently being worked on. Most flu shots are developed by inserting the influenza virus into chicken eggs with chicken embryos, resulting in a vaccine that contains egg proteins. The CDC recommends that people with non-life-threatening egg allergies, even if the allergy is severe, receive a flu shot, despite the risk of an allergic reaction. However, package inserts of flu vaccines say those with serious reactions to egg protein should not receive the shot. In Dr. Sear's book, he says on page 125 that people who are allergic to eggs should not get a flu vaccine. While flu shots do not contain aluminum, other vaccines do. It is important to note aluminum has been connected with developing and worsening food allergies, as described in the Journal of Immunotoxicology. The decision of whether to get a flu shot containing egg proteins and whether or not to combine this shot with other vaccines containing aluminum is a decision that should be weighed carefully by each individual. Antibiotics are used in vaccines to kill bacteria that may develop during the manufacturing process. Eggs, for example, are not sterile. To sterilize the eggs, antibiotics are added. Neomycin, polymyxin B, streptomycin, and gentamicin are examples of antibiotics used in vaccines. The CDC cautions against the overuse of antibiotics due to the increase in antibiotic-resistant bacteria. The CDC says this resistance is a dangerous threat that affects millions each year. Is it possible that antibiotics in vaccines contribute to antibiotic-resistant bacteria, especially concerning annual flu shots and the amount of vaccinations children receive? Evidence already shows vaccines are responsible for promoting the evolution of deadlier strains of viruses, causing the disease to be more severe. What effect does frequent injection of antibiotics have on bacteria resistance? Formaldehyde is used as an inactivating agent to inactivate the virus. Formaldehyde is a preservative. It is not used as a preservative in vaccines. Because its purpose is to inactivate, not to preserve, the FDA allows vaccines containing formaldehyde to be labeled preservative-free. Formaldehyde is a known carcinogen, and studies have proven that it causes cancer and destroys DNA when inhaled, ingested, or simply comes in contact with the skin. Studies proving its safety when injected, in any amount, are insufficient. In fact, all flu vaccine package inserts say flu vaccines have not been tested to see if they damage DNA or cause cancer. Dr. Sear says on page 248 of his book, "I could not find information on injected formaldehyde." In vaccines, polysorbate 80 is used as a surfactant to reduce the surface tension of a liquid. However, another medical use of polysorbate 80 is to help other chemicals cross the blood-brain barrier. Although this is not the purpose of polysorbate 80 in vaccines, it is possible that it still has that effect. What is the effect of viruses, bacteria, yeast, heavy metals, formaldehyde, and other chemicals on the brain when the blood-brain barrier is crossed? No studies have been done to know the answer to that question. Some vaccines, instead of using animal cell cultures or eggs, use cell cultures created from aborted babies. These vaccines do not contain fetal cells, but they do contain residual fetal DNA. Vaccine manufacturers prefer human cell strains for cell cultures because of production limitation problems with other mediums, such as chicken eggs. Cell cultures from aborted babies would allow more vaccines to be produced, preventing vaccine shortages. For this reason, flu vaccines in future years could contain aborted fetal DNA. These flu vaccines are currently in development. This is obviously a concern for anyone who is pro-life. This is also a concern for anyone who has a personal or family history of autoimmune disease. Examples of autoimmune diseases include eczema, type 1 diabetes, rheumatoid arthritis, lupus, multiple sclerosis, celiac, Crohn's, endometriosis, Hashimoto's, and more. Dr. Sears explains on page 232 of his book that because animal DNA is different enough from one's own DNA, the body recognizes it as foreign and creates an immune response. However, unlike animal DNA, human DNA is not different enough, and some people's immune systems start attacking their own DNA, resulting in an autoimmune disease. What about thimerosal, which contains mercury? In 1999, the CDC said, even though there was no evidence that thimerosal in vaccines was dangerous, the decision to remove it was made as a precautionary measure to decrease overall mercury exposure among young infants. Almost a decade earlier, a memo from Dr. Maurice Hilleman, a vaccinologist, was written to the president of Merck, a vaccine company. He expressed concern that infants 6 months old who received their shots according to schedule would receive a dose of mercury 87 times higher than guidelines for maximum consumption of mercury. When viewed this way, he said, the mercury load appears rather large. The CDC says mercury was removed from vaccines to reduce overall exposure. But was it? If there was concern in 1991, why did it take until 1999 for the FDA to be required by law to assess the amount of mercury in vaccines? In 2001, the Institute of Medicine said a causal relationship could not be proven nor disproven between thimerosal and neurological disorders. Because the possibility existed that thimerosal could cause neurological disorders, it was decided that all vaccines would need to reduce thimerosal or be made without it. The FDA allowed the vaccines with thimerosal that had already been manufactured to be used up until their expiration date in 2003, rather than being immediately discontinued in 2001, despite the risk of neurological damage. According to the FDA, preservative-free means that the vaccine can have trace amounts of thimerosal from the manufacturing process. Some flu shots contain trace amounts of thimerosal, just like many other vaccines. However, unlike other vaccines, some flu shots are still formulated with mercury as a preservative. Some flu shots contain 25 micrograms thimerosal. Since about half of thimerosal is mercury, this means these shots have 12.5 micrograms mercury. There are no flu shots for the 2017-2018 season with 25 micrograms thimerosal, according to package inserts. Other flu vaccines contain 50 micrograms thimerosal, which is about 25 micrograms mercury. Some flu shots for the 2017-2018 season do have 50 micrograms thimerosal. Some brands come in single-dose pre-filled syringes. Some brands come in multi-dose vials. Some brands come in both forms. Multi-dose vials will have more mercury added as a preservative than single-dose syringes. Why do flu shots still contain so much mercury? Not enough flu shots without mercury can be produced at this time. For instance, the FDA estimates there are about 6 million children younger than 2 years in the U.S. Each of these children needs 2 doses of flu vaccine, according to the CDC. That means 12 million vaccines are needed. However, in the 2005-2006 flu season, only 8 million flu vaccines with only trace amounts of mercury were available. That means 4 million children still received the full dose of 25 or 50 micrograms of thimerosal. The EPA, which is the Environmental Protection Agency, says 0.1 microgram per kilo per day is the safe exposure for mercury. A kilo is almost 2 pounds. This means that 25 micrograms thimerosal, which is 12.5 micrograms mercury, would be an unsafe amount for anyone weighing less than 265 pounds. According to the Flu-Laval quadrivalent vaccine package insert for 2017-2018, infants as young as 6 months are given 2 doses, each of which are twice that amount when multi-dose vials are used. Thimerosal may affect more than just children and infants. According to Dr. Hugh Fudenberg, a leading immunogeneticist, for those who have received flu shots for 5 consecutive years, the risk of developing Alzheimer's is 10 times greater than those who had only 1, 2, or no flu shots. One argument exists that ethyl mercury is less dangerous than methyl mercury. Methyl mercury is found in fish. This is why pregnant women are told how often they can eat fish and which types of fish should be completely avoided. The amount of mercury in vaccines is much higher than the amount in fish, but the type of mercury in vaccines is ethyl mercury. One study published by the National Institute of Environmental Health Services showed that monkeys who received ethyl mercury had a concentration of inorganic mercury in the brain twice as high as monkeys who received methyl mercury. Inorganic mercury remains in the brain much longer than organic mercury, with an estimated half-life of more than a year. This means it takes 1 year for the mercury to lose half its effectiveness. It's not currently known whether inorganic mercury presents any risk to the developing brain. Several studies have shown a connection between mercury and neurological disorders. These are just a few of the journals that publish those studies. How can the CDC say there is no evidence that thimerosal in vaccines is dangerous? Is the flu vaccine being used according to package insert directions? Are safety studies accurate? Package inserts for all 2017-2018 flu vaccines state that the vaccines have not been evaluated for carcinogenic potential, meaning can they cause cancer, mutagenic potential, meaning can they mutate DNA, or male fertility impairment. All flu vaccine package inserts for 2017-2018 say the flu vaccine has not been tested for concomitant use with other vaccines. In addition to the flu shot, infants 6 months old receive vaccines for up to 8 diseases. They also receive not 1, but 2 flu shots. Children 5 years old again receive vaccines for up to 8 other diseases in addition to a flu shot. Children 11 to 12 years old receive vaccines for 5 other diseases in addition to a flu shot. The flu shot has never been tested for safety in combination with any of those vaccines, according to package inserts. Children are not the only ones to receive the flu vaccine in combination with other vaccines. High school and college students sometimes receive the meningitis vaccine at the same time. Pregnant women often receive the Tdap vaccine at the same time. Senior citizens often receive the shingles vaccine at the same time, or the pneumonia vaccine. Safety studies have been performed. According to a study published in the British Medical Journal, 70% of flu vaccine safety studies had conclusions in support of influenza vaccination. However, only 18% showed an agreement between the data reported in the study and the study's conclusions. 56% of studies were at high risk for bias. One example of bias is the studies that received the most exposure are the studies that were funded by vaccine companies. Non-industry sponsored studies of similar size and quality were less likely to receive exposure. When looking at safety studies for any vaccine, always look for bias and check who funded the study. Then check to see what financial gain the sponsor has. To conduct an experiment according to the scientific method, one must declare a control, which shows what happens naturally, and a variable, which shows what happens when manipulated. Test objects are chosen randomly. The study published by the Journal of the American Medical Association, which was conducted with CDC funding, pulled records of children which were not chosen randomly. These children were not compared to unvaccinated children as a control. Children's case histories were included in the study only if an HMO doctor had seen them within 14 days of influenza vaccination. According to the National Vaccine Information Center, quote, dozens of convulsions and other adverse events, including brain injury, experienced by children after vaccination, were excluded from the study if the children had not been seen by an HMO doctor within 14 days of the adverse event, or were sick in the weeks before and after vaccination. End quote. Many children are sick before and during vaccination, as the CDC still recommends vaccines even if a child has a fever, cold, diarrhea, cough, or ear infection. Many people develop these symptoms as an immune response after a vaccine. All children with these symptoms were excluded from the study even if they had severe adverse reactions. Yet, the CDC uses the study to show that the flu vaccine is safe. What happens when a pregnant woman gets sick with the flu? What if she receives a flu vaccine while pregnant or nursing? What is the risk of influenza infection for pregnant women and their unborn children? The ACIP is the CDC's advisory committee on immunization practice. The ACIP says that influenza is rarely a threat to a normal pregnancy. In addition to that, a British study showed no evidence of influenza crossing the placenta when a pregnant woman is infected, and there is no significant impact on labor outcomes, health of the newborn, or maternal well-being. Another study in North Carolina over 5 consecutive flu seasons showed the general population had more outpatient visits for flu and flu-like illness than pregnant women. Therefore, research shows there is no increased risk of flu and flu effect in pregnant women. These studies and more are listed in the Journal of American Physicians and Surgeons. The CDC says there is a lot of evidence that flu vaccines can be given safely during pregnancy. However, the CDC adds, though these data are limited for the first trimester. The CDC recommends that pregnant women receive a flu shot during any trimester in pregnancy. If the safety data is limited for the first trimester, why would the flu shot be equally recommended for that trimester? The CDC says flu shots are safe and recommended for pregnant women. What do the package inserts of these vaccines say? Some flu vaccines have been assigned a pregnancy category B risk. This means that animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women. Although a risk has not been identified, it hasn't been ruled out. The package inserts for flu shots with a pregnancy category B risk state they should be given to women only if clearly needed. For the 2017-2018 flu season, these vaccines include Afluria, Fluvarin, Fluzone, and Fluad. Note that Fluad is only approved for ages 65 and older. These vaccines also contain a 50 microgram dose of thimerosal, unless the recipient asks for a single-dose pre-filled syringe instead of the multi-dose vial. Other flu vaccines have not yet been assigned a pregnancy risk category. When a pregnant woman receives one of these flu shots, she is to enroll in the Pregnancy Exposure Registry to be monitored. For the 2017-2018 flu season, these vaccines include Afluria quadrivalent, Fluarix quadrivalent, Flublock quadrivalent, Flucelvax quadrivalent, and Fluloval quadrivalent. Fluzone high dose is a pregnancy category C, meaning neither human nor animal studies have been performed. However, Fluzone high dose is only approved for ages 65 and older. Dr. Sears says, in my opinion, animal research is not enough and more human research needs to be done to verify the flu vaccine safety during pregnancy. Vaccines naturally cause an inflammatory response. Some conditions in pregnancy, such as preeclampsia and preterm birth, have an inflammatory component. Does the increased inflammatory response from vaccination in pregnant women increase the risk of preeclampsia and preterm birth? A study was performed that showed a measurable increase in inflammation when pregnant women were vaccinated. The study concludes, further research is needed to confirm that the mild inflammatory response elicited by vaccination is benign in pregnancy. Is the unborn child affected? Mercury is said to leave the bloodstream quickly. One study, published in the Human and Experimental Toxicology Journal, was performed where rabbits were injected with radioactive mercury to determine how mercury is excreted from the body. This study did find that the level of mercury in the blood drops by 75% within only 1 hour of injection. However, this decrease in blood mercury is not due to excretion, but to uptake of other organs. The level of mercury in the fetal brain, kidneys, and liver is significantly increased for up to 6 hours after injection. How does 6 hours of increased levels of mercury affect the brain of a quickly developing human unborn child? One study published by the International Journal of Epidemiology showed no increased risk of malignancies in children who were exposed to the flu vaccine in utero. However, this study excluded all pregnancies that ended in miscarriage without determining whether or not the miscarriage was caused by the vaccine. Pregnant women in the 2009-2010 flu season were given an annual flu shot and the H1N1 pandemic flu shot. Dr. Gary Goldman published a study in the Human Environmental and Toxicology Journal of an increase of miscarriage rates reported by these women. Miscarriage rates increased 40 times. The study concludes that single vaccine seasons may have lower miscarriage rates than the two-dose 2009-2010 season, simply due to the low level of investigation in single vaccine seasons. In other words, the 2009-2010 season was investigated more thoroughly. The study warns that combining a seasonal flu shot with any other vaccine during pregnancy may increase fetal toxicity due to the combination of biologically active components. What about women who are breastfeeding? The CDC says breastfeeding women should get the flu vaccine to protect themselves from the flu. How does this compare to the instructions in the package inserts of flu vaccines? The package inserts for all of this season's flu vaccines say it is not known whether the ingredients of the vaccine is excreted in human milk, that the effect of flu vaccines is unknown on nursing infants, and the effect on milk production is also unknown. Package inserts state, caution should be exercised. Are adverse reactions to the flu vaccine serious? Are they rare? Reactions to the flu shot include, but are not limited to, pain, redness, swelling, muscle aches, fatigue, headache, joint pain, shivering, and fever. Doctors in consent forms usually list these side effects. However, more serious side effects are rarely brought up by doctors or listed in consent forms. Many people receiving flu shots are not aware of these side effects, although they have a right to know about them, even if they are rare. A complete list of adverse reactions can be found in the package insert of the flu shot you are receiving. If a doctor cannot or will not give you the package insert, ask for the brand name of the flu shot you are receiving, and you can look it up on the FDA's website. It will not resemble a 1- or 2-page informational flyer. It will not resemble a brochure. It will be several pages long and will look similar to the prescription information packet you receive with prescription medication at the pharmacy. Here are some, but not all, of the adverse reactions reported for the Fluarix quadrivalent shot for 2017-2018, available for ages 3 and older. According to the U.S. Department of Health and Human Services, reactions to the flu shot may not develop right away. Some cases develop as late as 42 days after receiving a vaccine. How rare are serious adverse reactions to the flu shot? As of June 30th, 2016, the Vaccine Adverse Event Reporting System has received 128,194 reports of adverse reactions. Of that number, 1,270 of those reports were deaths. A law protects doctors and vaccine manufacturers from being held liable for vaccine injury. A report must first be made to VAERS and then must be taken to court to receive compensation for medical bills or loss of life. Compensation comes from the Vaccine Injury Compensation Program, which is funded by taxpayers. Of the 128,194 people who experienced an adverse reaction, only 2,954 were compensated by the VICP. Of the 1,270 deaths, only 109 families received compensation. While it is the law for doctors to report vaccine reactions to VAERS, it is estimated that less than 10% of vaccine reactions are reported. Therefore, the numbers you see here are low when compared to reality. Guillain-Barré syndrome is an autoimmune disorder where the immune system attacks the body's peripheral nervous system, causing temporary or permanent paralysis. Symptoms are similar to polio. Death can occur due to breathing problems, although the help of ventilators has decreased the statistic. There is no cure. The U.S. Department of Health and Human Services says the top flu vaccine injury awarded compensation is Guillain-Barré syndrome. Who is required to receive a flu vaccine? For those attending daycare, preschool, and kindergarten through 12th grade in the state of Missouri, some vaccines are required, although those vaccines can be refused by parents if a religious or medical exemption is filed. This is also true for all states in the United States of America, except for California, West Virginia, and Mississippi. The annual flu vaccine is not one of the required vaccines. This may change in future years. Students attending college or university should check with their school's requirements and exemptions. The annual flu vaccine is not required, but again, this may change in the future. Currently, military members, college students in healthcare curriculums, and medical staff, including secretaries, janitors, security, and chaplains, must receive the annual flu vaccine unless an exemption can be obtained. In the future, this could expand to others. California is currently trying to pass a bill that would require daycare workers to receive the annual flu vaccine. Teachers will probably be next. In some parts of Australia, parents cannot take newborns home before the entire family has been vaccinated. Even for those who are in the military, medical field, or medical school, exemptions exist. They are difficult to obtain, especially without legal aid. In the military, medical exemptions are granted after an adverse reaction. However, an administrative exemption can be achieved when a religious exemption is filed through the unit commander with medical and chaplain consultation. If the first attempt fails, a second opinion can be requested. Legal aid will probably be necessary. Medical staff and medical students are also able to file both medical and religious exemptions. In fact, 22,000 nurses refuse the flu shot each year. A person in this situation can file an adverse reaction to a previous flu vaccine, cite religious rights according to the Civil Rights Act, and file an EEOC complaint. Legal help may be necessary for an employer to recognize the rights of employees. In addition, state representatives can be written by anyone. I was recently speaking with a nurse who reacts to the flu shot because she is allergic to eggs. She has been unable to get a medical exemption because while her reaction is severe, it is not life-threatening. She was told to make sure emergency medical care is immediately available, but to still get her shot or lose her job. This nurse, and all nurses, have a right to decide what goes into their bodies. Legal aid does exist. A former professor of nursing received a seasonal flu shot in 2008. She thought that by getting her flu shot, she could keep her job. She developed Guillain-Barré syndrome from it. She suffers from total paralysis and is permanently disabled. She lost her job and is no longer able to work anywhere. Her medical costs have caused her to go through her savings. Without her pension, she would be destitute. Remember, there is no liability for doctors or vaccine manufacturers for vaccine adverse reactions. Likewise, if you are temporarily ill or permanently disabled by a vaccine required for employment, workman's compensation does not apply. In contrast, hospitals are paid to have 90% of their employees vaccinated against influenza. If less than 90% are vaccinated, hospitals lose 2% of their Medicare/Medicaid funding, according to the Federal Office of Disease Prevention and Health Promotion. If you decide to get a flu shot for yourself or your child, there are steps you can take to possibly decrease the risk if that is something that concerns you. First, read all package inserts for that season's flu vaccines. The 2017-2018 season has 11 different flu vaccines. While reading the package inserts, read the ingredients list, checking for any ingredients that concern you, whether it be thimerosal, formaldehyde, polysorbate 80, egg protein, etc. Once you find a brand that has ingredients you approve, make sure that brand fits your age group. Some flu shots are not meant for children. Some are only meant for senior citizens. The age group information should be on the first page of the package insert. Sometimes age recommendations are not followed, so it is important for you to know which vaccines have been approved for your age group, especially if you have a child younger than 3. When you go to get your flu shot, get it from a doctor's office, not a pharmacy. Doctors are better trained and equipped to handle immediate allergic reactions and adverse events. Next, ask for a single-dose pre-filled syringe and not a syringe filled from a multi-dose vial. A multi-dose vial is like the top picture. Several doses can be taken from the vial. Mercury is added to these vials as a preservative. Single-dose syringes are pre-filled similar to the bottom picture. They will have a label on them. While they are usually more expensive, they will have less mercury than a syringe filled from a multi-dose vial. Then ask to read the label on the vaccine. Do this especially if you have more than one child receiving a vaccine. Doctors are human and make mistakes. Sometimes an assistant prepares the vaccines, and the wrong vaccine gets sent to the wrong room and the doctor doesn't know. Sometimes siblings are accidentally given each other's vaccines. Sometimes children are given adult doses. You can help by reading the label and making sure the correct person is receiving the correct vaccine. Lastly, ask for a copy of the brand name and lot number of the vaccine. In the case of an adverse event, you will need this information to report it to VAERS. Doctors should record the lot number, but you should have a copy to take home just in case they don't. The flu vaccine brands listed in black come in single-dose, pre-filled syringes and have only trace amounts of mercury. The brands listed in red come in 2 different dosage forms, the single-dose pre-filled syringe and the multi-dose vial. If you are getting one of those 6 brands and want to avoid 50 micrograms of thimerosal, which is 25 micrograms mercury, then specifically ask for the single-dose pre-filled syringe. Note that the only flu shots for children younger than 3 years have mercury unless you request a single-dose syringe. There are 3 vaccines available without chicken eggs. The Flublok trivalent and quadrivalent vaccines were made using a cell line from the fall armyworm. Flucelvax quadrivalent was made from a cell line from canine kidney rather than eggs. There are only 4 flu shots that are Category B pregnancy risk for the 2017-2018 season. The only one without a dose of mercury is above the childbearing age range. The other 3 have a full dose of mercury unless you ask for a single dose pre-filled syringe. So if you are pregnant and wishing to get a Category B flu shot without a full dose of mercury, ask for the single dose pre-filled syringe of Afluria, Fluvarin, or Fluzone Quadrivalent. The other vaccines have less testing for pregnancy safety. If you do get a vaccine without a pregnancy risk rating, make sure you are enrolled in the Pregnancy Exposure Registry, even if you yourself have to make the call. The phone number is printed in the package insert. Again, the 2017-2018 flu season only has killed virus vaccines. In the future, this may change. If so, make sure to choose a killed virus vaccine, as live virus vaccines are not recommended during pregnancy, according to the CDC. If you choose to get the Tdap, do not get it at the same time. Wait at least 30 days between vaccinations. Do not get a seasonal and a pandemic flu shot during the same pregnancy, since miscarriage rates increased 40 times when this happened in the 2009-2010 season. Remember that no flu shot has been tested with any other vaccine, not just for pregnancy, but in the general population. If you or your child are receiving other vaccines, get the flu shot at least 30 days before or 30 days after other vaccinations. Do not take acetaminophen, which is generic Tylenol, before or after receiving a vaccination. Acetaminophen depletes glutathione, an antioxidant which is necessary for detoxification. Depleting glutathione may increase the risk of a vaccine injury. You can also help your body detox. There are several ways to improve detoxification, such as vitamin C, elderberry, probiotics, omega-3, and Epsom salt baths. Research vaccine detoxification to learn more. Keep a journal of side effects for 45 days. Remember that some people have developed Guillain-Barré on day 42. It helps to have a record of the seemingly insignificant symptoms leading up to such a diagnosis, especially if you need to seek compensation from the National Vaccine Injury Program. Report any and all reactions to your doctor and to VAERS. Your doctor may not take the time to do the paperwork, so it is important that you also file a report, even if the reaction is not a permanent injury. Remember, it is estimated that only 10% of reactions are reported. If all reactions were reported, it would assist in making vaccine safety more accurate. Whether or not you choose to get a flu shot, you do need to protect yourself from influenza and other diseases, and in doing so, protect those around you. The Karachi Health Soap Study was performed in Pakistan to determine what role hand washing played in disease prevention. 3 communities with severe disease issues were involved. One community was given regular hand soap. Another was given antibacterial soap. The third community was the control group and had no change. The communities that were given regular and antibacterial soap had a 50% decrease in pneumonia and diarrhea, the 2 main causes of infant mortality. This is despite no other health improvements, including nutritional deficiencies and sewage in their drinking water. We've seen this in history too. During the American Civil War, just as people were beginning to learn about bacteria, twice as many soldiers were killed by disease as by war. Women wanted to assist in the war effort, and when the Medical Bureau was inefficient at decreasing disease, women formed the United States Sanitary Commission. Women who worked for the sanitary were not only nurses, but they focused on hygiene by instructing soldiers in proper camp drainage, placement of latrines, cooking, and water supply. My favorite Civil War fun fact is that this was so effective that the Surgeon General required at least 1/3 of Army nurses to be women because they were more attentive to hygiene. But seriously, all this is to say, hygiene plays a very important role in health. Another way to fight against the flu is to make sure you have enough vitamin D. Many people are deficient in vitamin D. If you would like to know if you are deficient, you can ask your doctor for a simple blood test. Your doctor can tell you how much vitamin D you need to take. Studies have shown that those who get sick with influenza virus are often people with vitamin D deficiency. Although vitamins help, the best way to store up on vitamin D is sunlight exposure. It should also be noted that flu season coincides with the time of year when the days are shorter, when we have less sunlight. Countries with similar latitudes, which share seasons, also experience flu season at about the same time. In addition to vitamin D, a balanced diet is important. Getting nutrients from a variety of food helps the body fight off illness. Minimizing sugar, processed foods, and chemicals means your body has less work in processing ingredients that are difficult to expel. Lastly, if you are sick, especially if you have a fever, stay home. If your child has a fever, please don't give him a fever-reducing medication and send him to school or daycare anyway. That is how disease spreads. Stay home and rest so that the illness stops with you. Also, vitamin D is not only a great prevention for influenza, but a great treatment to help you beat the virus more quickly. Please remember, this is not professional advice. I do not have a medical degree. I urge you to verify what was presented here to compare and contrast the evidence. Don't be afraid to do your own research. One man had less than 1 year of schooling, yet he managed to become an American president. His name was Abraham Lincoln. There is nothing holding you back from learning. Discuss your research with one or more medical professionals. It may be helpful to interview doctors who have opposite opinions. The following slides are my sources for this presentation. Good luck in your decisions, and thank you for attending this presentation.